Bismillahirrahmanirrahim. Today lecture is about hypothyroidism, the causes of hypothyroidism and its effect on the body. So what is hypothyroidism? Hypothyroidism, also called underactive thyroid, is when thyroid gland doesn't make enough thyroid hormone to meet body needs. Hypothyroidism may not cause noticeable symptom in its early stages. Over time, hypothyroidism that isn't treated can lead to other health problems such as high cholesterol and heart problems. The effects of hypothyroidism are opposite to those of hyperthyroidism, but few physiological mechanisms peculiar to hypothyroidism. Hashimoto disease. Hypothyroidism, like hyperthyroidism, is often initiated by autoimmunity against the thyroid gland, which is called Hashimoto disease, but immunity that destroys the gland rather than stimulate it. In hypothyroidism, the thyroid cells are destroyed, while in hyperthyroidism, the thyroid cells are stimulated to produce thyroid hormone. The thyroid gland of most of these patients first have autoimmune thyroiditis, which means thyroid inflammation. This causes progressive deterioration and finally fibrosis of the gland with resultant diminished or absent secretion of thyroid hormone. Homeostatic imbalance due to hypothyroidism. Hypothyroidism result myxedema, creatinism, and goiter. So let's discuss them in detail. Endemic goiter caused by dietary iodine deficiency. The term goiter means a greatly enlarged thyroid gland. 50 micrograms of iodine are required each year for the formation of adequate quantity of thyroid hormone. In certain areas of the world, insufficient iodine is present in the soil for the foodstuff to contain even this minute quantity. Therefore, in the days before iodized table salt, many people who lived in these areas developed extremely large thyroid gland called endemic goiter. Mechanism of development of large endemic goiter. Lack of iodine prevents production of both thyroxine and triiodothyronine. This causes the pituitary to secrete excessively large quantity of thyroid stimulating hormone. The thyroid stimulating hormone then stimulates the thyroid cell to secrete tremendous amount of thyroglobulin colloid into the follicle and the gland grow larger and larger. The thyroid stimulating hormone causes production of thyroglobulin, but this thyroglobulin doesn't contain iodine and it is accumulated in the follicular lumen and it causes tremendous enlargement of the thyroid gland. But because of lack of iodine, thyroxine and triiodothyronine production does not occur in thyroglobulin molecule and therefore does not cause the normal suppression of thyroid stimulating production by the anterior pituitary. The follicle becomes tremendous in size and the thyroid gland may increase to 10 to 20 times normal size. Idiopathic non-toxic colloid goiter occur in people who does not have iodine deficiency. These goiter gland may secrete normal quantity of thyroid hormone, but more frequently the secretion of hormone is depressed as in endemic colloid goiter. Exact cause of idiopathic colloid goiter is not known. Most of these patients show signs of mild thyroiditis which cause slight hypothyroidism, lead to increased thyroid stimulating hormone secretion and progressive growth of the non-inflamed portion of the gland. This could explain why these glands are usually nodular, with some portion of the gland growing while other portions are being destroyed by the thyroiditis. Abnormality of the enzyme system required for formation of the thyroid hormone. Deficient iodine tapering mechanism, in which iodine is not pumped adequately into the thyroid cell. As we know that there is a pump on the thyroid cell which trap the iodine or pump the iodine into the thyroid cell and then into the lumen. So in some cases this tapering mechanism is abnormal and iodides are not taper into the thyroid cell properly. Deficient peroxidase system, in which the iodides are not oxidized to the iodine state. You know that then this iodide which is tapered by the thyroid cell are then transported to the lumen, and in the lumen this iodide is converted into iodine. In some cases the enzyme which is responsible for this conversion from iodide to iodine, the peroxidase enzyme, is deficient, and this iodization of iodide doesn't occur, which lead to hypothyroidism. Abnormality of the enzyme system required for the formation of the thyroid hormone. The third mechanism is deficient coupling of iodinated thyroxine in the thyroglobulin molecule so that the final thyroid hormone cannot be formed. Deficient coupling of iodinated thyroxine in the thyroglobulin molecule so that the final thyroid hormone cannot be formed. Deficiency of the deiodinase enzyme, which prevent recovery of the iodine from the iodinated tyrosine that are not coupled to form the thyroid hormone. This is about 2/3 of the iodine, thus leading to iodine deficiency. Tapering of iodide of those tyrosine molecule to which iodine are attached, and the enzyme peroxidase which cause coupling of these. When there is deficiency of this molecule, the coupling does not occur and lead to regeneration of T3 and T4 is affected. That's why iodine deficiency or hypothyroidism develop. Finally, some food contain goitrogenic substances that have propyl thyrosyl type of anti-thyroid activity, thus also leading to thyroid stimulating hormone stimulated enlargement of the thyroid gland. Such goitrogenic substances are found especially in some variants of turnip and cabbages. Symptoms of hypothyroidism. Symptoms of hypothyroidism are tiredness, sensitive to cold, constipation, dry skin, weight gain, puffy haze, hoarseness of voice, development of frog-like husky voice, sleeping up to 12 to 14 hours a day, scaliness of the skin, coarse hair and skin, muscle weakness, muscle ache, tenderness and stiffness. Menstrual cycle that are heavier than usual or irregular. Thinning of hair, slow heart rate, also called bradycardia, depression, memory problem, edematous appearance throughout the body called myxedema. So myxedema develop in patient with almost total lack of thyroid hormone function. With such a patient demonstrate baggy under the eye and swelling of the face. In this condition, greatly increased quantity of hyaluronic acid and chondroitin sulfate bound with protein from excessive tissue gel in the interstitial space, and this causes the total quantity of interstitial fluid to increase. Because of the gel nature of the excessive fluid, it is mainly immobile and the edema is the non-pitting type. These are the symptoms of hypothyroidism. Low temperature or sensitive to low temperature. The BP is low. The patient is vulnerable to infection. Shallow or slow breathing. Absence or slow reflexes. Change in the mental state, pulse below 60 beats per minute. These are the symptoms which occur in hypothyroidism. Atherosclerosis in hypothyroidism. Lack of thyroid hormone, increase in quantity of blood, cholesterol, alter fat and cholesterol metabolism, and diminish liver excretion of cholesterol in the bile. The increase in blood cholesterol is usually associated with increased atherosclerosis. Deposition of cholesterol in the wall of the vessels cause narrowing of the vessel. This is called atherosclerosis, or a deposition of cholesterol in the wall of the vessel is called atherosclerosis. Therefore, many hypothyroid patients, particularly those with myxedema, develop atherosclerosis, which in turn result in peripheral vascular disease. You can see the blood supply to the legs impaired and they become blue or cyanos. Develop atherosclerosis, which in turn result in peripheral vascular disease. Deafness and coronary artery disease with consequent early death. Cretinism. Cretinism is caused by extreme hypothyroidism during fetal life, infancy or childhood. This condition is characterized especially by failure of body growth and by mental retardation. It results from congenital lack of thyroid gland, congenital cretinism. When the thyroid is absent at birth, it is called congenital cretinism. From failure of the thyroid gland to produce thyroid hormone because of genetic defect of the gland, or from iodine lack in the diet, which is called endemic cretinism. The severity of endemic cretinism varies greatly depending on the amount of iodine in the diet, and whole populations of an endemic geographic iodine deficient soil area have been known to have cretinoid tendencies. Symptoms of cretinism. The symptoms of cretinism include lack of weight gain, stunted growth, lethargy, poor feeding, fatigue, thickened facial feature, abnormal bone growth, mental retardation, very little cry, constipation, fluffiness, excessive sleep, low muscle tone, hoarse voice, usually large tongue, swelling near the navel and neck. Diagnostic tests in hypothyroidism. The pre-thyroxine in the blood is low. The basal metabolic rate in myxedema range between -30 and -50. The secretion of thyroid stimulating hormone usually greatly increase, except in those rare instances of hypothyroidism caused by depressed response of pituitary gland to thyroid stimulating hormone. Treatment of hypothyroidism. It is easy to maintain a steady level of thyroid hormone activity in the body by a daily oral ingestion of a tablet or food containing thyroxine. So thank you. Please subscribe the channel, don the bell icon and write your valuable comment in the comment box.